Welcome to Newslaundry Chhota Hafta. For the full episode, subscribe because it is behind the paywall and only subscribers get access to uncut, complete content. Newslaundry Hafta is our weekly wrap of all that made the news, all that didn't, and all that should have and all that shouldn't have. We agree, we disagree, we critique, and occasionally we beat each other up. But it's all good fun. Subscribe.
This is a Newslaundry podcast and you're listening to NL Hafta.
अंग्रेज अपना लगान और न्यूज़ लॉन्ड्री अपना हफ्ता कभी नहीं छोड़ते. Welcome to another episode of Hafta, the last recording of the year. It will go online on the 1st of Jan. So those of you who do make it, I guess most of you will, because at least in India, no celebrations are happening. So you'll be going to sleep early. You can wake up and listen to Hafta on the 1st, which will be a first time for many of you. So Happy New Year to all of you in advance to begin with. I hope this year is fantastic for everybody. And the last recording of this year, we have a fantastic panel for you as a gift, as a New Year gift. So let me first introduce the panel before I tell you about our Christmas scheme and our merch, and we've extended it till what time. Joining me in the studio with me is Anand Vardhan.
Hello.
Anand, the oldest member of the Newslaundry team now, along with me. And Manisha, I guess, but Manisha's had one continuous run. Anand has had two. Joining us on the phone line from somewhere in the hills of an unknown area is Manisha Pande. Hi, Manisha.
Hi. So mysterious.
So mysterious. Joining us on the phone line from Mumbai is Naresh Fernandes. Hi, Naresh.
Hi, I'm in disguise. I'm wearing a false mustache.
All right. So that will throw all of you off. But most of you already know who Naresh Fernandes is. So those of you who don't, he is the founder and editor of Scroll.in, one of the oldest and largest, I guess, digital news ventures. He's worked as editor-in-chief of Time Out India and has worked for Times of India in Mumbai and the Wall Street Journal in New York. And he has also written a book, Taj Mahal Foxtrot, the story of Bombay's jazz age and city adrift, a short biography of Bombay. He, as you can imagine, is क्या कहते हैं, jazz nut. He knows a lot about jazz and all that. And all that jazz. Ha ha. Uncle joke alert. Also joining us on the phone line is Jammi N Rao. Hi, Jammi.
Hello, hi.
So Jammi,
Happy New Year to everybody.
Yes, has appeared on the Hafta earlier as well. Those of you who have been reading his columns in Newslaundry and Wire. Have you also written for Scroll at any point, by the way, Jammi?
One piece in Scroll.in. Naresh may not know about it, but
Okay. So he's an independent public health physician and epidemiologist. He has over 25 years of experience in Britain's National Health Service and 5 in the senior civil service with the Department of Health. He's a visiting professor in public health at Staffordshire University and writes, like I said, for Newslaundry and Wire, and has also contributed a piece to Scroll. I'm Abhinandan Sekhri, and this is Newslaundry Hafta. Before I let Manisha go over the headlines, just want to remind everybody that our Christmas merchandise, our Christmas package, not just the merch, of course, that many of you have already gifted to many people, including us, but that offer has been extended till the 5th of Jan, I believe. So you can make the most of this offer. You get a discount on the Newslaundry subscription, and you also get discount on the merch. So you can pay to keep news free and also get fantastic merch because we don't take any advertising from anybody. So I would urge you to please contribute because journalism has to be supported by people like you. Otherwise, it will die. And while you're at it, go to Scroll.in. Even they have a subscription plan. Do contribute generously. It doesn't take much from one person, but many thousands of us doing it together can make a reporting team that can rival legacy media. So I hope you will consider it. On that note, Manisha, please give us the headlines. Thank you.
Yes. Delhi police cracks down on protests by a large number of resident doctors. The Federation of Resident Doctors Association has been protesting for a while now. This is over the delay in college allotments of postgraduate medical students. More than 2,500 resident doctors were detained. There were dramatic scenes. Meanwhile, the Delhi police has denied using lathi charge and said they have utmost respect for doctors. Junior doctors have said today that they will continue their agitation as talks with Union Health Minister Mansukh Mandavia remained inconclusive. Meanwhile, the Supreme Court has asked the Centre on NEET PG admissions that how have they arrived at the rupees 8 lakh annual income limit for the EWS quota. Video released of Haridwar meeting shows speakers calling for a war on Muslims and urging Hindus to arm themselves. The controversial Yati Narsimanand, I won't call him controversial, he's quite despicable actually. He faces several FIRs in UP. He called for a war against Muslims and urged Hindus to take up weapons to ensure a Muslim did not become the prime minister in 2029. The ex-UP Shia Waqf Board chief Wasim Rizvi, who converted to Hinduism, was booked for this meet. Later, 2 more were booked in connection with hate speeches. Their names are Swami Dharmdas and Sadhvi Annapurna. 5 of the event participants went to Haridwar police station to file a counter complaint against Maulanas or clerics and other unnamed Muslims persons. And they're seen in a video laughing with a police officer. They're presenting him with an FIR. Their chants of Har Har Mahadev as they're presenting him that. And they asked him to be on quote-unquote our side. Meanwhile, Pakistan has summoned Indian diplomat over concerns about hate speech against Muslims in Haridwar event. There's been an FIR against Hindu religious leader for derogatory remarks against M.K. Gandhi. This is in Chhattisgarh. A statue of Jesus in a church in Ambala was smashed. This is among the spate of attacks on India's Christian communities around Christmas. There was Bajrang Dal burning effigies. In Assam, right-wingers disrupted proceedings and demanded that all Hindus leave. This made front-page news on the NYT. India has banned Mother Teresa's charity for receiving funds from abroad. UK's COVID-19 cases are breaking records as Omicron spreads across the globe. In India, Delhi has the highest Omicron count with 238 cases, followed by Maharashtra with 167 cases. Delhi is now under yellow alert, so schools are shut, metros will run at 50% capacity. Delhi has witnessed a sharp increase in COVID-19 cases, and cases may likely peak in February. This is what the experts are telling us. Meanwhile, the government panel has recommended EUA, which is the Emergency Usage Authorization for COVID-19 vaccines Covovax, Corbevax, and anti-COVID pill Molnupiravir. Covaxin is the only option for 15 to 18 years age group. That's what the government says. PM Modi made an announcement at night. He said that vaccines for children and precaution doses, not booster doses, would be given to frontline workers and senior citizens. Even as all that is happening, UP election rallies are in full spate. COVID safety norms are, of course, thrown to the wind. BJP MP from Ratlam, Gumnam Singh Damor, has been served a notice by the Alirajpur court in an alleged rupees 1,600 crore scam.
I think 600 crore. Yeah, 600.
600 crore rupees scam. He reached Bhopal to clarify and then he ran away from office after seeing cameras. So he was being chased by media people there. Jharkhand CM has slammed the BJP and has defended the anti-lynching law. And a suspect in the Ludhiana court blast, Jaswinder Singh Multani, was arrested in Germany.
Before we move on, as part of the Christmas offer from 17th to 26th of December, where you get your favorite Newslaundry products like Nirvana masks, etc., that offer has been extended to the 5th of Jan. So check out the offers at newslaundry.com/Christmas-offer. It's in the show link below. It's newslaundry.com/Christmas-offer. But you can just click on the link below. The new subscription plans we've launched, the game changer for 3 years, get an 8,000 rupee discount and a lot of free merchandise. That's also easier for us because the new RBI guidelines already have impacted the recurring subscriptions, and from the 1st of Jan, we don't know how the new format is going to change our subscriptions because apparently none of the wallets can save the card details anymore. So if you can just subscribe in one shot, it just saves you the recurring subscription inconvenience.
This is where, I know this doctor you're talking about, chap called Afshin Emrani. I think that's the name you're talking about, isn't it? When he says that we can afford to stop testing. This is not the first time he said it. He put out a tweet on the 28th of December saying the answer is to stop testing for Omicron. He said, yes, stop testing. And the reason is, this has been circulated widely in WhatsApp and so on. By the way, he's not a doctor from Israel. He may be Jewish. I don't know what his background is. But he's actually a cardiologist based in Los Angeles. I looked him up, Afshin Emrani. He's a fellow of the American College of Cardiology. He's been treating for some time that Omicron is a mild variant. This is the way in which the whole pandemic will fizzle out and peter out, and we'll be back to a pre-pandemic, pre-March 2020 style of living again, because everybody will get this infection, they'll get immunity, and that will be the end of that. The trouble with this theory is that the previous infection with the Delta variant did not prevent us from getting Omicron. You see, large numbers of people, even after 2 doses of vaccination, after maybe getting the Delta variant or the previous Alpha variant, and then getting 2 doses of an effective vaccine, the vaccine immunity wanes after about 3 to 6 months, and then they are getting the Omicron variant. They're getting infected with it. Infected meaning they're getting symptomatic and they test positive. What the vaccine does, of course, is though it does not guarantee that you will not get the infection and fall ill, maybe with symptoms, what it does guarantee is that you will not get seriously ill or get into hospital. So which is why, though the cases are rising at a very dramatic pace, almost 10,000 more each day than the previous day for the last few days in England, for example, and it has now reached almost 117,000, 120,000 cases a day, hospital admissions are not going up quite as much as they would have done had the same pattern been repeated that we saw earlier in 2021.
I see.
And that is why one of the data points that the government is closely following before announcing lockdown measures is the hospitalization data. And that is because of the political significance of hospital overcrowding and the NHS coming under pressure and ordinary cases not being treated. By ordinary cases, I mean cancers, heart disease, all the usual stuff that hospitals do. If that starts clogging up, then there will be political fallout for the government and they will impose a lockdown to make sure that that doesn't happen.
Right.
What does all this mean for infection spread across the world? My gut feeling is that this chap, Afshin Imrani, is barking up the wrong tree, really. The idea that just because Omicron is mild will prevent infection is not very dissimilar to what was argued in the early days, that, okay, the infection will sweep through, let natural herd immunity take its course, some people will die, and then the rest of us can resume life as normal. That didn't pan out quite that way, did it? Young people were also affected. And now we are seeing that children are getting affected. And okay, it's not very common, agreed, but some children are getting admitted into hospital and some children are suffering the ill effects of what's called long COVID. So it's a matter of balance between whether you say a certain amount of morbidity and mortality is acceptable or it is not acceptable and we should do our best in order to stop it.
Is there enough data to suggest that vaccinated people are less likely to get this new Omicron? Is it significantly less?
That is definitely good data about that. Definitely decent data about the effect of vaccination. The third booster dose, for example, does confer immunity sufficient to either prevent the infection in many cases, but even if it doesn't prevent the infection, it will at least prevent serious illness and hospitalization and certainly death. Though there have been a few cases where people have died despite getting, not the booster so far, but despite getting 2 doses of the vaccine.
Now, Naresh, if you want to weigh in on any of the health aspects, feel free. But as the editor-in-chief of a news organization for whom election is the World Cup, and since it's not a general election, it's UP, Punjab, Uttarakhand, Manipur and Goa. How are you looking at deploying your reporters? Because, we had a meeting here 2 weeks ago. And now I'm just thinking that, even though they're vaccinated, it just kind of says, okay, now what? Like, because election is serious business. Yeah. Do you want to weigh in on that other than any other aspects of what's happening on the whole COVID numbers?
No, you're right. How does one keep one's colleagues, ensure that one's colleagues are safe in a pandemic? That's the challenge we faced and the question we had to ask ourselves when this weird virus first made its way into the world March 2020. And now it's something we're asking ourselves again. I think we've asked our colleagues not to travel for at least until the new year, where we will begin to reassess the threat of all of this. But yeah, it's a constantly shifting situation. And I think we will have to keep reevaluating how we deal with it. But it isn't the easiest thing to make spontaneous decisions about.
My own view, Abhinandan, was that the issue of postgraduate doctors, these are not students, don't forget. They are students. Doctors are students for life. I agree with that. These are postgraduate students applying for resident doctor positions, both in the public hospitals and in the private hospitals. I don't think the private hospitals are that badly affected in many ways. I'm talking of the smaller private hospitals in towns and cities across India. But these are professional issues to do with professional training, qualification, and specialization. And to an extent, the fact that we don't have a national health service as such in any state, and that very few people depend upon an organized system of healthcare and are prepared to pay out of pocket for private healthcare, and it's a very dispersed, diversified system, means that this does not penetrate the consciousness of the media and the politicians quite as much as in many other countries it might happen if junior doctors went on strike. So, for example, to take the example of England, okay, much smaller country, much more organized. A strike by a call for strike by the BMA would be big ticket news. It would appear on the 9 o'clock news in the evening. Every newspaper would cover it. Questions would be raised in Parliament, and something would be done to avert the strike if possible. The BMA itself, the British Medical Association itself, would argue that strike, they would not call a strike unless there was a very, very good reason for it, very major reason for it, because they have an agreement with the government that they will not strike. B, their voice would be heard by the government of the day. And in any case, the health service is a kind of a holy cow, if you like. No party wants to be seen to be against the health service. It would be a suicide note for them if they spoke out against the health service or did not do something positive about the NHS. So that's a different situation. Put that to one side. The other point I wanted to make on this question was that the medical profession in India is often, in my view, quite selfish in that they speak up only when they are directly affected, but they don't have the kind of social consciousness that in many other countries the medical profession, as an organized profession, has. So the Indian Medical Association, for example, does not have a considered view and a campaigning role in things like domestic violence, general violence, or alcoholism, or smoking, better diet, better nutrition, and so on. They don't take a stand on socially important issues of the day,
or even vaccines. I mean, or
health.
even dispelling some myths about the vaccines that were propagated by, if not
Exactly.
myths, I mean, just the way the leaders of our country were irresponsible in talking about vaccines. The IMA did not weigh in.
Yes, exactly. They did not take a sufficiently proactive stand.
You had that one doctor give it off to Ramdev though on Aaj Tak. He was from the IMA.
Indeed.
That was one, correct.
Indeed. That one chap did. He was a brave chap who stood up. But as a profession, as a whole, they do not have a campaigning mode, which, for example, the American Medical Association, of course, to their discredit, they campaign very effectively against any attempts to set up a national health service type healthcare system in America. So even Obamacare was hotly contested by the American Medical Association. But the British Medical Association, for all its faults, has been at the forefront of campaigning on a range of issues. They have a stand on, say, for example, euthanasia or assisted dying or smoking, alcoholism, domestic violence, on everything. They have a policy position which most doctors on local radio, local newspapers, and so on support actively. So that level of social consciousness is lacking. So it's no surprise if they start protesting against police violence, for example. There is not the same level of support for them as might have happened had they, in turn, in earlier days, supported other people when they were protesting against state laws or against what they saw as unjust laws and so on. So even a simple matter like, for example, the quality and state of forensic reporting in India, postmortems, autopsies, and so on, which is entirely a medical matter. I see no political stand on it by the Indian Medical Association or by the doctors who are involved in it, who stand up to political pressure and say, we need to do the right thing by our population. That view does not seem to be there.
Yes, so I think this will happen in the margins, on the margins in Chhattisgarh, in Jharkhand, in Punjab, where numbers are smaller and people are more isolated. I think it will be a while before this moves to sort of burst our bubbles of privilege in cities and where there is a longer history of Christianity. Somehow, I have, over the last couple of years, been thinking a lot about my relatives in Pakistan. My father's family came, parts of my father's family came to India in 1947 from Karachi. There's still a large, significant community of Karachi Goans. And in the 1980s, as Zia and Islamic fundamentalism began to become more intense, a great many of my father's cousins chose to move to Canada. So there are now more Karachi goans in Toronto than there are in Karachi, I believe. And I've always, we always used that sort of moment to think about how to compare ourselves and talk about how lucky we were that we lived in a secular republic, and this was not going to happen to us. I think it's going to be a while before we get to that position of physical danger in cities. But it's clear that this will be used to pressure Christians. The attacks on the margins will be used to send a message to Christians that we are just as unwanted in this country as our Muslim neighbors are. In some way, I can't help thinking about how some sections of the community have brought this upon themselves. They have flirted, and more than flirted, with the BJP. Love jihad, you must realize, you may remember, is a phrase that was sort of invented by Catholics and by the Catholic Bishops' Conference in Kerala. Large sections of my neighborhood, I live in a place called Bandra, which has significant numbers of Catholics, vote for the BJP. It's driven by Islamophobia. And suddenly, people are sounding shocked. But of course, this, as you pointed out, is a part of the core ideology of the BJP and Hindutva voters. It has been for a century. So I don't see why people are now expressing surprise and shock.
I think every editor there in that meeting should have revolted and should have said, we don't want to be in the same space as this guy. Here he does programming on UPSC jihad, the kind of despicable things he gets away with talking about Muslims. I mean, pure bile, nothing of sense comes out. There's Hindutva and there's whatever right wing, and there's just complete bile which this guy represents. And I think journalists at that point should have just said that we don't want to be in a meeting where he's invited. Please don't call him the next time you call us. But anyway, that's never going to happen. So, and Suresh Chauhan, let's forget the BJP. You even have Congress people giving him interviews. You've had Digvijay. I don't know why he's entertained. It is just beyond me.
Even that SP guy, what's his name? Azam Khan. Azam Khan gave him a long interview.
I guess they don't watch him. It's beyond me. I don't know anyone who's aware of what he does. Why would they want to be in the...
How we are in the age of cowardice. Cowardice is now, I think, there have always been cowards in public life, but I don't think cowardice has been a virtue worth emulating. It has not been a celebrated virtue. I think cowardice has become a celebrated virtue, whether it is the cowardice of editors, whether it is the cowardice of Narendra Modi. You see, he's too much of a coward to say, I condemn this. And he dare not say that, I endorse this. So he just will not say anything, and it's not a fringe.
Yeah, I mean, he met the Pope. He also put out a tweet on Christmas, whatever.
I mean, including, people, well-meaning people who kind of, call me and say that, take it easy on Twitter. You've been raided once, cowardice has become a virtue to be emulated. And I think that is very unique about, I'd say, the last few years, where everyone is unashamed of being a coward. And that is very unique. And not only are they unashamed, they are proud of it because it is what the leadership is showing us. So yeah, that's my rant on the subject. All of you listening in, the Chhota Hafta, do subscribe so you can listen to the entire Hafta. We will see you again next week with the Hafta. Till then, subscribe, pay to keep news free, because when the public pays, the public is served. When advertisers pay, advertisers are served. Thank you. Goodbye.
All the Newslaundry podcasts are available on Stitcher, iTunes, and any other podcast platform.
Please subscribe to Newslaundry. Help us keep news independent. To catch all our podcasts on news, pop culture, current affairs and sport, visit newslaundry.com. Follow us on Facebook, Twitter and Instagram, and subscribe to our YouTube channel. Sun liya Afrika, mufat khoro. Not to brag or anything, but Newslaundry Hafta features in the top 50 in the world on SoundCloud in the news and politics category for podcasts. So do subscribe and see what you're missing. Because when the public pays, the public is served. When advertisers pay, Advertiser served. Subscribe, help keep news independent and free.
All Newslaundry podcasts are available on iTunes and Stitcher and any other podcast platform.